Welcome to the May edition of Health Check 360, sponsored by Toma Memorial Hospital. May has been Stroke Awareness Month at Toma Memorial Hospital. Emergency Director Suzanne Downing joins us with tips about stroke awareness, plus a little bit about the hospital's urgent care and that department and hours. So welcome, Suzanne, to the links. It's great to have you. So May is
Stroke Awareness Month, so we're just wrapping up, and we highlight a few tips about what to look for and what to do if you notice symptoms of a stroke.
So what would a person be looking for if they were viewing somebody or even experiencing it themselves?
Sure. So the things that we watch for, we use an acronym called, it's FAST. So F is face, so facial drooping, especially on one side.
Oh, like you're literally not smiling and it's just...
Yep, if you smile, then the one side of the face would stay down, whichever.
Okay, so face, okay.
Yep. A is arms, so loss of movement or loss of some movement of one side of the body, typically. If you hold the arm up, you're not able to raise it or you're not able to keep it up.
So like your brain isn't connecting with that voluntary movement.
Yep, exactly.
Oh, okay. Interesting.
S is for speech, so that would be difficulty speaking, difficulty with word finding, difficulty getting the words out, and sometimes it's even being mute or not being able to speak at all.
Okay, speech then.
Yep, and T is for time. So time is wasting, and if you notice any of those symptoms of a stroke, then it's time to call 911.
So Suzanne, could you have one symptom and not the others? Or
Absolutely.
Could you have all of them?
Yep, any or all.
Any or all, so just a facial, and so it's face, arms, speech, and time. And time is of the essence.
Time is of the essence. The sooner we can intervene, the better outcomes are typically.
Can I just ask you just quick, what for our viewers, what is a stroke?
A stroke is a brain attack similar to a heart attack. So it's a lack of blood flow, and then the brain doesn't get the oxygen that it needs to function.
Okay, so brain is the stroke. That's the difference.
Yep.
Okay.
Exactly.
And what are some risk factors or things that could be prevention of a stroke?
Sure. Two of the biggest risk factors are smoking and hypertension. So it's always a good idea to quit smoking at any point in life.
Okay, so that's the oxygen flow to the brain.
Yep,
and
exactly.
So when you're smoking, you're, okay.
Yep. And then the other one is hypertension or high blood pressure. And many people have high blood pressure and don't know it. So that's why it's important to go to your annual physicals with your doctor, because they'll keep track of that for you.
Right, and then making sure that, is there any other signs or anything of prevention that the awareness brings up at all?
Well, two things that can be done as a lifestyle change, in addition to quitting smoking, would be to limit your amount of salt in your diet and to move more, to get more exercise. Right,
get the blood flowing and the oxygen.
Yep, absolutely.
Okay, let's transition just a little bit to the urgent care.
Sure.
So can you tell us a little bit about urgent care, maybe the hours, and if there's any changes happening and with hours and services?
Yep. So urgent care is available at the emergency department. It is for minor illnesses and injuries. So when you come into the ER, the nurse will see you and triage you and determine whether you can be seen in the urgent care area or in the ER. Urgent care hours are from 9 a.m. to 9 p.m. So if you arrive between those hours and your symptoms match what we can see in urgent care, then that's the area that we'll put you in. We also do have Warren's Clinic, Warren's Walk-In Clinic, just up the interstate, about 6 miles. They're open daily from 9 a.m. to 6 p.m., and they see the urgent care type illnesses and injuries as well.
Even though it's the clinic in Warren's, you don't need an appointment. You can walk in and say,
it is walk-in.
If you have some of those symptoms, like you said, the fast even.
Well, that's not an urgent care type of thing.
Okay.
If you notice any fast symptoms, we would encourage you definitely to call 911. Okay.
So that's the timing that you said earlier.
Yes, absolutely.
Suzanne, thank you for joining us.
Thank you.
It's great to have you.
Thanks.
Well, you can find this and past editions of the Health Check 360 on our Links 24 Facebook page.